Hey everyone, this is Cheryl and welcome to my YouTube channel. I just wanted to come on here. This video is well overdue. Mostly I do my posting on Instagram and Facebook, but I know that I seeked out to YouTube to try to find videos on everything I could, making my decision for plastic surgery, weight loss, doctors, all of that. So if I could help one person, that's what we're here for, right? So today's video, I'm just gonna, basically it's gonna be raw. I'm not gonna edit this at all. So if I stumble or screw up, we're just gonna keep rolling with it. So on today's video, I'm going to explain what I had done. I'll show you my incisions live. I do have a few pictures over here on the computer. Again, I'm not making this fancy. I'm just getting to the point. But I'm just gonna try to go through in my head the questions that I'm constantly asked and answer them as best to my knowledge to help anyone that is seeking these answers and giving my opinion. And I don't want to defend or offend anyone out there and your physician. I'm just going to say the names that I would personally go to as a doctor in Mexico and a couple names that I would not go to. And that's my opinion, and I have a right to that opinion. So please, no negative comments. If I mention your doctor's name that I don't like, well, that's my opinion. So to go with it, so number one question that I get, what did I have done and why did I have that done? So really quickly, I'm not going to spend too much time on this. So I had a floral de lis tummy tuck. And what that is a tummy tuck where they do 2 incisions. It's a horizontal and vertical incision. I also, with that, had a 360 body lift all around my body. He lifted me up I think it was like 4.7 inches. He lifted me up, and my abdominal muscles were 19 centimeters apart, which is approximately like 7.5 inches apart, that he sewed together my muscle repair. And yeah, so he did a lot. Plus I had breast augmentation. I still have 2 surgeries to go. A lot of people ask, what is a floral de lis tummy tuck and why? And does everyone have to have that? No. So it all depends on your body type. You know, did you lose a lot of weight? A lot of times with weight loss, you have a lot of extra skin. So that skin can only be pulled down vertically or horizontally so far, and when you have a lot of skin, you kind of have to go vertically and horizontal to get everything tucked in there. And that's usually why people have a floral de lis tummy tuck, is because of really excessive weight loss patients, like bariatric weight loss patients would get these tummy tucks. Let's see, another question. Boobs. A lot of people get implants and they get CCs. Usually the common is like 450, 475, 500, 550. Well, I wanted to go more fuller, and I did not want to regret not having fullness in my breast. So I personally got 625 cc's, and they're silicone and no texture. He uses Modavi. It's Motivia, I believe. You can always message me. I can give you the correct spelling. But they're well-known implants that most surgeons use in Mexico. So with that said, let me go ahead and show you. So my surgery, and I did post not too long ago that my belly button looked like it was closing. So yesterday I posted on Instagram and Facebook that I put a marble in there, which I got from girls on the Facebook page. So here's my belly button, and I will show it to you. I have had a marble in my belly button for 2 days now, and it literally works. It literally tucks in your belly button so your belly button doesn't close. So here, I'll just go ahead and take that off now since can't retape that. So that is my belly button, and the tummy and the marble is working. So my breast here, like I said, are 625 implants, 625 cc's. I did not get a lift because when he did my vertical incision, the markings for my breast went off. he knew I was coming back for another surgery, so therefore he did not want to risk not doing them perfectly, which I totally am happy with. And I want him to do what is, you know, he thinks is best. So sorry, my stomach itches, and oh my God, I've been itching like crazy lately. So, anyway, these are 625. Again, he didn't do the lift in the surgery because the markings went off. So, I mean, I won't show my nipples, but they are low. So that my next surgery in late January, February will be my lift, and will be my skin on my arms, and my neck is going to be lifted. That is my next surgery. So to show you the incisions, they are, sorry, I have these little pads here. I don't know if you guys can see them. There's 2 incisions here. This one without this steri, these are like wound strips, steri strips, whatever. I obviously need to change them because I've had Manuka honey on them all day. But these are the 2 little incisions that I have. And so he did a lift, sorry. So he did a lift here. Let me kind of show you. Which then obviously pulled my thighs up a little bit, but I still need to get a thigh lift in my last surgery with my BBL, my Brazilian butt lift. So here are the 2 little incisions. They're looking fine. They're not infected. They're still oozing. That's why this maxi pad is here. He did my lift all the way around. As you can see here, I'm still really swollen here. Obviously there's swelling here in my abdomen and lower abdomen. I mean, it's only been 5 weeks, but all in all, this is where my drain was right here. But all in all, it looks really good. This is my back. So anyway, that's that. And let me get dressed real quick so I can show you this. Okay. So with that said, so why everyone gets on here and they're like, oh my God, I'm so swollen. Oh my gosh, I'm walking hunched over still at week 3, at week 4. I'm at week 5 walking still hunched over. So let me give you an example of why we're hunched over. I have videos of my actual surgery, but I'm trying to gather all of them so I can put them together. And I was having issues with my editing video tool. That's why this is kind of like patchy, this video. But these are pictures and photos of me on the OR table and doing my Fleur de Lis tummy tuck. So let me just show you this. This is kind of crazy. So you can see, get my marble out of the way for God's sake. So if you can see, here is the incision that he made. Let me like zoom this baby up here as much as I can. So this is the incision of my lower back lift. And also I was bleeding a lot. I did not have to have a blood transfusion, thank God, but I was taking vitamin E, and I did not know that thinned your blood. So if you take vitamin E as a supplement in your vitamins, stop taking it before surgery because it makes you bleed. So this is the incision that he did on my back. So this is the Fleur de Lis plus 360 lift. So now this is one piece of where my back, this is the other piece of my back here. Let me show you here. So here's one side, here's the other side. He already closed me up here. And then we wonder why we're swollen and wonder why we can't walk straight. Well, anyway, so that's that. Then now, obviously I can't hide the nipple shot, so I apologize, but anyway, so now this is my back still right here. And see these lines? He's literally gonna make a continuous cut all around my abdomen. So this whole thing is going to come off as one big piece of skin. I mean, it's absolutely incredible. So, whoops, those are before and afters. This is him numbing up my pelvis area. These are, I guess, tucked back or hanging down, not sure. But this all then will be removed as one big piece of skin, which is absolutely insane. And those are the videos that I'm waiting for, because I cannot wait to see that. I have a few videos of him doing the back, but I want to see the whole thing. It's pretty crazy. So yeah, so when we're wondering why we're sore, we're wondering why we're swollen, well, we're getting cut to pieces, people. So anyway, that's what I had done. Why did I have to have that done? Is because I lost over 100 pounds. So the question is, how did I lose the weight? There's many videos about that on the YouTube channel, but you can always message me and I will be happy to tell you how I lost over 100 pounds all on my own, no surgery. Now let's think of what the questions that I get. So the questions are, is it safe to go to Mexico? Well, yes, of course it's safe, especially with the crazy drug cartel information that we have gotten of those women getting killed in northern Mexico. So of course the drug cartel exists and they're real and it happens, but Tijuana, Guadalajara, they're very touristy places. If you don't go in the wrong spot and mess with anyone, you are fine. The city is relatively clean. I mean, there are little places that are, but isn't that anywhere we go? Where I had my surgery, where I stayed in my hotel, I stayed at the Grand Hotel. It was really, really nice and lots of restaurants. The hotel was immaculate. I know that my doctor's office, which my doctor is Dr. Ricardo Vega, his office is always immaculate. It smells better than my house, I swear. So yeah, is it safe to go to Mexico? Yes. Then you just literally cross the border, nothing happens. And most of these physicians that do this plastic surgery are within 3 to 10 minutes from the border of San Diego. Coming back, I've gotten questions like, how do you come back? Well, you should get a medical pass. Your doctor, regardless of who you go to, whether it's for a consult, your visit, your surgery, your checkups, will give you a medical pass. In order to get that, you just need to take a quick image of your license plate, give it to them, and they will give you a medical pass. That will then allow you to drive back to San Diego through the medical pass line, and you will save 2 hours. If you guys are from out of town, then you don't have to worry about it, because usually the doctor, whoever you're going with, their coordinator, or whoever they have, their driver, will come pick you up from San Diego, bring you across the border, and take you back, and so you don't have to worry about any of that. But if you are driving, it's a piece of cake. Just make sure you have your driver's license and your birth certificate if you do not have a passport. Medications coming across the border, no big deal, no problems. You just tell them you had surgery, your doctor's a visit. They'll ask you, are you bringing anything over? You just tell them you have medicine. I've been across the border a dozen times with medicine. Not one time have they checked. So don't worry about that. It's medicine that's prescribed to you and it's totally fine. Okay, so as far as the surgery goes and the aftermath of the surgery. So the first 2 days literally was the worst, I have to admit. I literally could not do anything without my boyfriend's help. As time has gone by, I'm at week 5 now, as of Monday. I'm just now being able to get in the Jeep without a step stool, do a little bit of light housework. I definitely recommend anyone getting the FDL tummy tuck. You definitely need 5 to 6 weeks off of work, depending on what you do. Absolutely. I'm an ultrasound tech and I'm just now going back to work next week, and I'm still a little nervous because we keep pretty busy and patient after patient, and I haven't worked full-time in almost 6 weeks, and I haven't worked full-time since I've had this surgery. So I know every day I'm getting stronger and I will be fine, but I definitely recommend at least 4 to 6 weeks with the FDL tummy tuck. If you have a regular tummy tuck, again, 4 weeks. I mean, your body just went through a very traumatic experience and it needs to heal. So let it heal. What other questions do I get? What do I take? So I take, as far as vitamins go, I take multivitamin, vitamin C, and arnica. Arnica. I take it in tablet form and in tea. It definitely is helping with the swelling. So I highly recommend that. What else? As far as like antibiotic spray or creams, the doctor will give those to you to put on your wounds. people that have the vertical and this FDL tummy tuck, like I got, having a couple open wounds is normal. You know, that it just, your skin opens. Again, all about the marble, put it in your belly button, regardless of the tummy tuck you got, because that's a new opening in your body. You know, just like when we get our ears pierced, we take the earring out, guess what? It's going to close, right? So I noticed that my belly button was looking a little like outy. It was kind of pushing out. So my wonderful little daughter-in-law gave me the advice of the marble, and of course everyone on my Facebook group said marble, and it works like a charm. So you just tape it in your belly button and it definitely pushes it back in. So highly recommend that. As far as like creams or whatever, I've just been putting like vitamin E oil. They told me avocado oil, which I haven't got that yet, but I think I'm going to. Let's see. Now, again, I haven't sneezed or coughed in like almost 6 weeks. Like, that's the challenge, you know. It's not so much this surgery was painful, it's just more aggravating because you can't move your body a certain way. You have to lie 45 degrees at an angle. When you get up, everything is just, you know, so like handicapped. You know, the way you get up, the way you sit down, the way you get in the car. Definitely just need to be patient and know that your body just went through a lot and it needs a lot to heal, and you just don't go through that and jump up out of bed and go to the gym and act normal. That's just not reality. And it was getting frustrating, you know, to me a little bit because I'm a busy mom and I have a very active boyfriend and you just want to go and do and all these things. But you know, don't force your body. You know, I knew that I couldn't even go to my last daughter's cheerleading competition because it was at Magic Mountain, and I know that I can't walk around Magic Mountain all day. I mean, just don't set yourself up for failure. Know that your body needs to heal. You need to listen to it. When you're tired, sit down, air out your incisions, make sure they stay dry, they're clean, make sure that your garments stay clean. And I think that is really the success to healing. It's just babying yourself and really paying attention to your body and what you need. So, okay, that's that. Again, let's see what else. So as far as doctors go, I went to Dr. Ricardo Vega. He's board certified. He's been doing it 20 years. He's safety first. And not only all of those things, but I literally reached out to all these women on his Instagram page, which they were so lovely and kind and sweet to, excuse me, I got a message, kind and sweet to respond to me and talk to me. And I just felt 100% confident in this doctor, no matter how scared I was, because this is scary, you know, this is very scary. And I don't want to ever take that lightly. You know, girls are scared and you have the right to be. I mean, this is a big deal. And but again, you know, you have to do your research and you have to feel comfortable. So the doctors that I highly would recommend would be Dr. Ricardo Vega, Dr. Galvez. He's a younger surgeon now. With Galvez, I think he does amazing work. I would totally trust him with my life. I would feel comfortable and confident with him. Him and his team, I've seen and heard nothing but wonderful things. I have, you know, reached out to him and talked to his coordinator, which is actually his brother, Andy. They're all so very nice, but with him, he does bariatric patients and most of them look really great. But for me, he does people a little bit too square. I kind of want more of a tapered look. Also, he doesn't do Vaser lipo. The difference between regular lipo and my doctor, Ricardo Vega, doesn't do Vaser lipo. So, which is another whole topic, but the difference between Vaser lipo and regular lipo is Vaser uses ultrasound technology, which I'm an ultrasound tech, so I totally appreciate that. But it uses ultrasound technology to break down the fat so you get more and it's less harmful to the tissue around it. So it's less aggressive, but you get better results. And obviously, where most of us are doing lipo in order to get a butt. So if you can get more fat that is less aggressive to go in your butt, why wouldn't you, right? So with that said, I know that I will pick a doctor, which is, I can never say his last name, but it's Pantoja. Tanja, whatever. I love his butts. I think he's amazing. Lots of experience, board certified. I hear nothing but amazing things about him. I'm going to be seeking a consult with him soon for my lipo and BBL next year after my second surgery that it's going to be in February. So my second surgery again is going to be my breast, my neck. I'm going to get a neck lift, and my arms. And I will be going to Dr. Vega for that. And then my last surgery, I'm going to be consulting with Dr. Tanja. I know I'm butchering his name, sorry. But for my BBL, lipo, and most likely leg lift. I got to see how many he's done. I want to see some before and after pictures, but that's my plan. So what else? Anyway, so the doctors I don't recommend, or I would not personally go to, is Dr. Byas. I at first liked his work. I mean, he does do pretty good work. He's not board certified. I think he plays a little bit too much Russian roulette with the BMIs. He's had a few complications lately, and I keep seeing more and more. I don't believe he does it at a hospital. I think it's a clinic, which that's not really break me or make it, but yeah, I would not go to anyone that's not board certified. I don't care what you do, and especially when you are doing procedures on risky patients of high BMIs. I mean, I'm not willing to go to a doctor that takes those risks. No. Also, another doctor out there is Dr. Guadalajara, I believe his name is, with Vive. Not a big fan. Again, I've seen some amazing results come out of their facility, but also a lot of infections. I've seen MRSA. I just recently watched a video live this morning, or this afternoon, sorry, and the doctors, like, I'm in the medical field. I've been in surgery multiple times, okay? And if you guys out there know an OR nurse or are an OR nurse, I mean, you guys are Nazis, and I love it. But you don't go into surgery and do surgery on someone that's open with your mask halfway down your face, you know? I mean, I remember I commented on that, and one girl said, you know, Cheryl, stop and stop trolling. No, hello, you are doing surgery. Like, we have MRSA in our nares, you know? And both of the doctors on each side of this woman, live surgery, literally had their mask like down their face, not covering their nose. If that's your thing and you don't care about it, girl, go ahead. But that's my opinion, and I just multiple things that I just don't feel comfortable with what I've seen through with them, and I just wouldn't recommend Vive. So the doctors that I highly recommend, Dr. Campos, Dr. Galvez, Dr. Ricardo Vega, which was my doctor, who else? And Dr. Patanja. That's who I want to have a consult with. Oh my God, I gotta learn his name. So that's it. I mean, I don't, as I'm sitting here thinking and I'm live and I know that I'm not going to be editing this video, I'm just trying to think, what do you need to take with you? I mean, don't take the whole house, really. You need maxi pads for your incisions. I try not to use too much tape, because the tape broke my skin out. Let's see, what else? Take your vitamins. Oh, one huge thing was being constipated. We were like on day 6, I went to the bathroom, and oh my God, it was the most painful thing ever. So highly recommend stay hydrated prior to your surgery. Multiple reasons for that. Start taking stool softeners maybe a few days after or before your surgery. Definitely make sure you take them a few times a day, but right after your surgery, because that was literally one of the worst pains I had. Wasn't even the surgery, it was going poop after. So yeah, so make sure you stay hydrated, take your stool softeners, and let's see, this is why I go live, but yeah, I mean, but that basically in a nutshell are the questions that I get. Just trying to think offhand if I can think of anything else really quickly. No, I can't. So again, I just want to make this video just to the point, answer any questions. By all means, if you have any questions, reach out to me. I'm on Instagram, I'm on Facebook. I will put my information with this video. And that's it. I really hope you the best. If you are trying to lose weight prior to your surgery, I definitely could help you with that. Give you some tools and tips that I tried and it worked. You know, anything that I can help you with, feel free to reach out to me, and I will definitely reply right away as soon as I can. So I think that having plastic surgery is very scary. I think that we as women go through a lot in life and we deserve to be happy. I knew that losing weight was a big deal for me. Getting my body back was something that I was going to do, and it's happening, and I couldn't be more proud of myself. So just be proud of yourself, and hopefully you have a good support team. And I get comments too where guys and husbands and mothers and sisters and don't really support someone doing this, but you have to realize that everyone's going to have their opinion, and you need to make yourself happy, and that's the number one thing that we all need to keep in mind. That's the most important. So with that said, I wish everyone great luck and success. Having a peace of mind about how you feel in your own body is priceless. So that's that. I will see you soon. And again, don't hesitate to reach out to me. Okay? Take care.